We can get started.
Okay, great.
Hi, welcome to my Lunch and Learn video series. I'm here today with Susanna Younts of Labella Birth and Baby and also Mama Earth Massage Therapy. I'm Amelia Maddox and I'm a doula and health educator here in Greensboro, North Carolina, and I'm really excited to have Susanna because I have not had the opportunity to speak with someone that does massage therapy, specifically prenatal massage.
Yeah, great. Well, thanks for having me.
Absolutely.
This is great. Yeah.
Yeah, of course. And you know, with all three of my babies, I had loads of massage therapy, and always made sure that I went to someone who was trained in prenatal massage, and it made such a difference. So tell us a little bit about how you got into this work.
So I had my first child about 7 years ago.
Okay.
And typical first mom story, did not have a supportive care provider, didn't hire a doula, didn't know all the things that I know now, and had a traumatic birth, and it was really difficult. And so after that birth, I was like, I know something has to be better. Like, I know that doesn't have to be this way. And I think this is a typical story for most birth workers. And so I started looking and studying, or researching, and I decided to become a birth doula. So I was in my previous career full time. So I went through doula training with Birth Arts International.
Okay.
And, did my first births and all of that. And eventually crossed paths with Chelsea Tate, who owns Labella Birth and Baby, and joined her team. And after my son was born, decided I was going to doula full time and left my previous career. And then, and I promise this all links around, and then as a doula, I realized that, I love massage therapy. With my son, he was a little past his estimated due date. So I got an induction massage. I had him 7 hours later. I was like, this is cool. And so I started doing some research, and I realized that, there is a lack of massage therapists who truly understand the physiology of birth and natural birth and have experience with that. And so there's a lot of amazing massage therapists and a lot of amazing prenatal massage therapists, but I think the birth community was definitely missing someone who kind of had an understanding of both sides.
Yes.
So I went to a massage school, which is about, I think it was like 800-ish hours.
Okay.
Got a diploma, passed the state licensure exam, and here I am.
Here you are.
Yes.
Well, we're glad that you're doing this work.
Yeah.
So what is the biggest difference between regular massage therapy, therapeutic massage, and prenatal massage?
Yeah. So, you'll hear some people say, well, massage is massage is massage. And that's absolutely, it's true and not true. I mean, massage and prenatal massage have a lot of the same benefits in that they help reduce stress. They help increase oxytocin levels. They help decrease insomnia. They help with aches and pains. They help with headaches, and all of those things that, whether you're pregnant or not, you may be dealing with.
Sure.
But the importance of making sure that you're with a massage therapist who is certified and experienced with prenatal is that there are some contraindications for pregnancy. Now, they exist. Contraindications for massage exist across the board.
Okay.
But in pregnancy, you want to make sure that you're working with someone who knows signs of when massage shouldn't be happening, who knows areas possibly to avoid. And then as you get further into pregnancy or you're ready to have your baby, someone who's trained in induction massage, which includes acupressure, loosening of different muscles and tension in areas that maybe you wouldn't focus on earlier in pregnancy. Aromatherapy and things like that for induction. So definitely it's a safety thing. I think that and then also just the needs can vary from pregnant mom to non-pregnant person. So,
And so is there a special licensure or registration or certification just for prenatal massage?
There is. So in North Carolina, if you are licensed as a massage and bodywork therapist, you technically do not have to be certified in a modality to perform it. However, and the board says this, and this is a consensus amongst massage therapists, you obviously do not want to do a modality that you are not trained in, because you want to make sure, obviously there's liability reasons, don't want to falsify yourself. And so I did take a separate prenatal postpartum induction training after I got my license. So I got out of school, got my license, I had all my basic licensure hours, and then I went into that program. So
that is really interesting. And so so tell me a little bit about some of these contraindicators and things that you may or may not want to do with someone who is pregnant.
Yes. So contraindications, and they can vary based on your trimester. So the biggest concern let's talk contraindications first. So spotting, any leaking fluid, severe cramping, sudden onset of swelling, severe headache, any kind of blurred vision, anything that could indicate that there is a problem with mom or baby. So anything that your care provider would say, call me.
Right, and so then you wouldn't want to work on someone that was having those issues.
So if you were to book a massage with me and, you were having spotting at any point in pregnancy, minus like your last couple of weeks when that's normal pre-labor, then I would say, let's postpone this, get up with your care provider. Because if anything is going on, we don't want mom to wait to seek care from her doctor or midwife. So
so that's a safety concern.
Yes, absolutely. Absolutely.
And so what are some things you would or wouldn't do with someone early in pregnancy that you might do later in pregnancy?
So this is one of those topics where if you ask one expert, they say one thing, and ask another, they say another, like so many things in the medical field.
Right.
So it used to be the myth that if you were first trimester, you shouldn't get massage, that it could induce labor or pregnancy loss. So research and studies have shown that is absolutely not true. As long as you're with someone who's certified and knows what they're doing. I mean, you definitely don't want anyone that's going to push mom's body beyond the boundaries that, and so for my practice specifically, as long as you don't have a history of recurrent pregnancy loss and you're low risk and there's no bleeding, cramping, signs of miscarriage or possible impending miscarriage, then I will take you regardless of where you are in your pregnancy. And there's fertility massage therapists which is not something I do, but I mean, they massage women all through their fertility journey. So, and again, I mean, it's a risk versus benefit like it is with anything else. But massage is relatively low risk.
So I want to talk about this induction massage.
Everybody does.
Right? So I know that folks who are getting towards the end of their pregnancy and you're really feeling it, right? So not only are you just uncomfortable in general, but when you're getting there later in those later weeks at 40, 41 weeks.
Plus,
Yes. So you might want to see someone for perhaps yourself, for induction massage. And how is that different than a regular massage?
Okay, so I want to start by saying that induction massage does not guarantee that you're going to go into labor. If it did, I would be really rich and every massage therapist would be doing it. As a doula and someone who's seen a lot of births, if your baby and your body aren't ready, I mean, nothing you can do minus medical interventions is going to put you into labor, or make baby come before they're ready. But one of the biggest holdups that we see in moms is that they're like watching that pot waiting for it to boil. And I know because I've been there, I've done that, like I said, with my youngest. And so induction massage is really focused on, and a lot of massages, but specifically releasing fear about childbirth, relaxation, kind of taking mom away from where she is. And then, I mean, that's an emotional and mental standpoint. From a physiological standpoint, we are really working on your adductors, which are your internal like thigh muscles. Your hip muscles, your pelvic muscles, a lot of sacral work, anything that we can do to work with that relaxin to help loosen up, obviously the most important area to loosen up.
Yes, that pelvis region.
Yes. We also work on tension patterns that may be causing, you could have a knot somewhere that's causing the body to tense somewhere else.
So like if you had a knot in your neck and it's causing you pain and stress here, it could be also causing pain and stress somewhere else.
Yes, because those tension patterns work on different paths or paths through the body. And so, and then also acupressure. So there's specific points on the body that can be held through reflexology or acupressure that are known to induce contractions.
Okay.
And then also some aromatherapy. So, yeah.
Well, I can see why seeing someone like yourself who's trained in this would be really important, because you wouldn't want to try those points yourself, or like if you don't know exactly
overdo it.
Okay.
Yeah. So it's possible. It's like, when we tell moms, well, why don't you try to pump a little bit? We tell them do it for a little bit and then stop. You don't want to do anything that's going to overstimulate the uterus.
Sure.
So yeah, and then also, because I'm also a doula, sometimes we'll do a little bit of spinning babies if there's a positional thing going on. Then we do some rebozo work maybe during the massage. So it's a 90-minute session to make sure that I can meet mom, we can figure out what's going on, and then customize it to what she needs.
That's fantastic. And Spinning Babies, they have some amazing resources on their website. Some of it is free for anybody.
Yes.
So
if you're
Google Google Spinning Babies. I mean, like, especially with like baby positioning, to get the baby in a really good optimal position for then going into labor.
Yes, absolutely. Yeah.
Well, that's so fantastic. So where? Oh, I know. I thought of one more question.
Yeah.
Okay. We didn't talk about this, but I want to know: do you have any success stories you would like to share?
I do. So obviously I can't give a lot of client information, but I have actually had. I don't know. I've had a good. Pretty rate. I think I did the numbers, and I hate even saying this publicly, but I did the math on the number of induction massages I've done, and I'm like 78%.
So like going
into labor within 48 hours.
Oh my goodness!
So again, that is not scientific research. That's just me literally writing down my clients that have had it and figuring out when they had their babies. Sure. I mean, like I said, their bodies were ready, and I definitely am not some sort of magical. No induction massage therapist is some magical miracle worker.
Sure. But that release of tension,
it really,
it's so helpful.
It is so helpful. Yeah.
And I think that's what a lot of folks, they get towards the end of their pregnancy, and you're so anxious to meet your new person.
Yeah.
And you get to the end of your pregnancy, and then some of that anxiety just manifests itself into your body and causes a lot more stress and tension. And something that, when you are trying to go into labor, when you notice some of those contractions, relaxing is the best
thing you can do
to speed up labor, is just to relax.
Yes.
When we naturally want to tense up with that pain.
Yes.
This is something I learned recently, is that we've been telling everyone to do Kegel exercises for years, and like that, the holding of your pelvic floor muscles. But in reality, it's actually maybe causing us more tension.
Yeah.
We need to be teaching people to kind of push against that in the pelvic floor.
Just like with any muscle where you want to strengthen it and then stretch and relax it, your pelvic floor is no different.
Exactly. Yes.
So while the Kegels are great because they do strengthen it, I mean, you gotta stretch it, and you gotta do some relaxation, and I mean, that's self-care you can do at home. You're absolutely right. It's the same thing. Yeah.
It's the exact same thing. And so I can imagine that if you go to massage therapy, prenatal massage specifically, then what you're doing is helping everything just relax.
Yes.
Because baby can't come out if all of your muscles are tight.
Right.
The baby has to, everything has to be loose.
Everything and every system in your body works together. And that includes your mind. And so, it's somatic. The mind-body connection is a real thing. We see it as doulas. I mean, anybody can see it in their daily life, how your mind really can affect what your body does. It's just like you get tension headaches, or you hold stress when you're, in your shoulders, so it's very similar.
For sure.
Yeah.
Well, and for folks who have already had a baby and you're in that postpartum period, it's so difficult to try and get to see someone but I imagine you also you see postpartum folks
I
as
do.
well.
So I do postpartum massage, and that can be, I do ask that if you've had a cesarean birth, that if you're not waiting 6 weeks, that you just get approval from your doctor.
Yes.
That's something we can talk about on a case by case basis. But I do see postpartum moms. They bring their babies. They can lay propped up on the table, nurse their babies during massage. I know it's hard for moms to get out of the house and take care of themselves. Sure. And then for postpartum moms, in the first 6 weeks, I also make out calls. So it's easier. They don't have to come to me. I can come to them.
Oh, so. That's wonderful. And that's how I wanted to kind of finish up where you're located and your contact information.
So my office is the community house at Village Family Chiropractic in Kernersville. And then to book, you could either find me on Facebook. I'm Mama Earth Massage Therapy on Facebook. Look for my purple hair. Or mamaearthmassagetherapy.com.
So, fantastic.
Yeah.
Thank you so much for joining me today.
Absolutely.
This is such wonderful information, and I think that, and I strongly advocate for massage therapy and prenatal massage. So thank you so much.
Thanks for having me.
Yeah. All right. Take care. Bye.